Guru Nation, thank you so much for watching. Make sure you like, subscribe, comment, share. It really means a lot to me. This is another rolling in my car opinion piece. My views, my opinions on the industry. We are in whether you are an entrepreneur in the space or a business owner in the space or somebody that works in this space at any level, you have to understand this is a competitive industry. It's right now in 2024, if you're in the job market, you're seeing exactly how competitive this industry is. And it's not only because you're competing with your fellow colleagues in the United States, you're competing globally. We're seeing a lot of outsourcing of jobs to Latin America. We've seen in the past outsourcing to Eastern Europe and India. That's going to continue. But there seems to be this prevailing thought in this space that there is an indefinite growth, and very well may be the case, but the fact that every company that's in this space, so CROs, sites, tech vendors, even sponsors, but I'll leave sponsors out of this because they're the ones that kind of pay for everything, but sites, CROs, and tech vendors, and employees, we're all just competing, and there is no actual monopoly. Like the last monopoly we've had in this industry was the original CRO, right? The initial quintiles. And maybe, I'm not a CRO historian, I don't think there is anyone that is, as far as I know. My educated guess is that they enjoyed monopoly status for about a decade. So Dennis Gillings created the concept of a CRO in the late 70s. I believe in the early 80s he got it commercialized. Then in the 90s you started seeing so maybe 2 decades, a decade and a half. In the 90s you started seeing other CROs competing. And now you've seen competition, you've seen consolidation, but there's still competition, right? No matter how you rearrange the market, whether there's 20 CROs taking whatever market share there is, or 5 taking basically the same amount of market share. It's just rearranging the dynamics. It's not shifting monopoly. Competition's still there. Competition exists because the blueprint has already been laid out for what a CRO is, and I don't want to say it's easy to start a CRO, because as someone who's doing that right now, it's not. But there's perceived barriers of entry, and then there's actual barriers of entry, right? And the real barriers of entry, like the actual barriers of entry, are networking. So your sphere of influence, how are you going to get deals? And knowledge. And by the way, this is the same barrier of entry for sites. Sites have an additional one in regards to access to patients. And CROs kind of share this same variable. So there is not going to be a monopoly anytime soon in this industry. The closest thing to a monopoly that failed was decentralized clinical trials, right? Doing studies directly in patients' homes. That has yet to succeed. And it seems like the industry is moving away from that and going more towards consolidation of sites, which we're seeing with the site networks. We might start seeing some vertical integration as well. I've already talked about how site networks, the savvier ones, because they're essentially faced with the same challenge. When you expand so much and grow so much, there's only so much market you can actually take, because you're still in a competitive industry, right? You are not doing anything different than others. You may have different variations to it, but at the end of the day, if you're a CRO and you're a site, it's pretty clear and well understood by everyone in this space what the core competencies are, right? So the only way to expand is to vertically integrate at this point, which you saw the CROs doing with tech vendors. They acquired a lot of tech vendors, they acquired a lot of technology, and technology is one of the ways to exponentially expand market share. But competition is ultimately what I call a race to the bottom. And I tell everyone that's got a tech company in the space, myself included, Patient Ace, right? That's me, Ronick, and Chris. We're running Patient Ace. Ultimately, profits are competed down to where the margins are slim because other entrants come in. So unless you're an order of magnitude better than everyone else, either a better service, a better output, or cheaper, right? And we're competing on a couple of those fronts with Patient Ace, but really it's the price. Like, we are affordable. We believe that there was a huge excess of profits that a few small patient recruitment or a few large patient recruitment vendors basically had monopoly power over. Once that technology of how do you arbitrage ads on social media, once that was competed down, which we are now, we can offer these cost savings to sites and sponsors, right? And that's going to force everyone else to also be competitive. Competitive businesses are not actually good. I love this book 0 to 1 by Peter Thiel. I think everyone should read it. Competitive industries end up going to zero. Now, the people who benefit from it are the customers, ultimately, right? And who is the ultimate customers in clinical research? It's the patients. But everyone else that's got their hand out in the middle, if you're in a competitive business model, which everyone is, regardless of whether you say, no, well, no one's doing it like this, okay, that'll last for a little bit, but it'll ultimately get competed down, which is fine. We can innovate, we can vertically integrate, we can horizontally integrate. But at the end of the day, no one really has monopoly power in our industry. So the way I see it, we're going to have a bunch of innovation. We're going to have probably an expansion. The one thing that's saving us is the market itself, meaning the amount of studies that are going to be made possible by AI, by finding molecules quicker, by identifying molecules earlier on in the process, like with AI AlphaFold, which I believe Google has already demonstrated that they can predict protein folding. And I mean, this is going to expand our market, right? So it's going to delay this not being a lucrative industry for some time. I would say 3 decades, if I could look out as far. So I'm a optimist. As a competitor in this space, like we all are, I'm an optimist. There are much worse industries to be in. You could be a realtor. Let me tell you, that's probably not a good. You're seeing this firsthand right now in the real estate industry with lenders and realtors. I mean, it's all commoditized and being essentially competed to zero by technology firms. But in our industry, we've got, because the market's growing, because the pharmaceuticals and biotechs, they're able to do more with the technologies they have, which, by the way, they're probably the closest things to having the potential to be monopolies, as long as the patent protection exists. So they're the closest ones to be having monopoly power. But since they are the funders, they are the ones sponsoring everything, they are the ones that could technically control prices. But because they have competition as well, they can't necessarily lowball sites or CROs as long as you have successfully proven that you can produce outcomes. But if you're a site CRO or a tech vendor, you do not have price control. And I know there's a lot of vertical integration. Some site networks are trying to use technology to encroach upon CRO core competencies. That's fine, but if others are doing the same thing, that is not an order of magnitude better than your competition. So you might have some first mover advantage, but not for long. So it just becomes this game in our industry of competing, basically. And there's nothing you can actually do, but if we start, and myself included, whether you're an employee, or a company in this space, not just thinking about differentiating yourself, because I think that the differentiation, like the rewards you get from differentiation, you'll probably reap the rewards of that for a few years in this space. Also, I believe a reason why our industry has seen only incremental changes and why there really hasn't been a monopoly, and this is probably for a good thing, and this is probably good for us considering we are in a competitive market. No one wants to take risks. Like, the traditional way to create a monopoly is to completely take over, like create a new category, right? Peter Thiel calls it creation versus incremental improvement. Well, our industry, I think, is going to continue to just be incremental improvements. There's probably going to be a creation in the sense of a lot of vertical integrations, but a lot of it done well with the cooperation of sites. And I think that's why organizations like Save Our Sites is even more important. But it's probably a good thing, because we don't want to break things and then disrupt and break things until you got a solution. Like, that's the old adage in regular tech companies: break things until they work. You don't want to do that when it comes to patient lives. So this is why we're going to continue seeing the incremental improvements in our industry, which is probably a good thing for all of us, since no one is immune to this competition. And this is probably why we feel, as sites, generally as sites, that we are not truly competing with each other, because the market keeps expanding, the therapeutic areas get more complex. Not every site is capable of doing every study. There's still a demand for new sites, and there is still a demand for new entrants. So I don't want this to be just doom and gloom. Excuse me, I don't want this to be just doom and gloom. There's still a demand for new entrants, and that's probably a good thing, because if the attitude in this industry was, let's break things and then innovate, it might be really bad for not just patients, because that would not be safe, but for sites and CROs as well, and tech vendors. So we have a growing market, increasing complexity. We have an industry that incentivizes incremental improvements as opposed to moonshot monopoly creations. And that will incentivize, and that will continue to keep the cash flow growing, whereas in most competitive industries, profits are competed down to zero. In our industry, profits are being competed down. We're seeing that with the employment, with just employees and contractors. But the market is still growing, so you're kind of negating the progress of technology and profits being competed down with the ever-growing marketplace innovating, new indications, more complexity. Now the FDA is throwing in mandates for diversity. So it's creating a larger demand, while technology is, little by little, dropping prices down. But things move quickly. We have things like Save Our Sites, we have things like this channel, like other channels, where it becomes easy to share best practices. You got to think of, how can you become a monopoly of one? Either your company or you as the employee yourself. How can you make yourself indispensable? And that's a stretch challenge for everyone, a stretch goal for everyone, myself included. And I just want to leave this video on that optimistic, indefinite optimism, which is probably what would describe me and how Peter Thiel would describe it. Let me know your thoughts on this and what you guys are planning on doing. Like, subscribe, comment, share. Bye-bye.